Hey gang, tonight I'm going to show you guys how I inject my estrogen. And hopefully I'll be able to get it right this time. The last time I put too much in and turned me into a girl. Not really. If you're thinking about doing injectable estrogen, it's the safest thing you can do. Safest way you can do it. Okay? It's intramuscular. You can put it into your thigh or you can put it into your butt. I can't see what the heck I'm doing back there, you know? So I can't, I want to put it in my thigh where I can control what's going on. Now, you want to get it in your upper thigh and into a muscle. And a tip to make it not so painful is putting ice on it. So I have one of these ice packs. Put ice on it for 4 minutes. Okay? So I'm just going to look at the timer on my phone to tell me when my 4 minutes are up. I'll probably be talking there for 6 minutes by the time I get this done. Every time I try to do it, I screw up the injection and I can't. I use a BD retractable needle. Now, I'm not going to get into gauge sizes or any of that other stuff. That's what your doctor is for. And, you know, I don't want anybody doing any black market estrogen or hormones. That's what your doctor is for. Okay? Yes, I know. But you can't have any. Okay. He's going to tell you how to do this, but if you want to ease into it a little bit by watching somebody else do it, no, okay, not right now. Not right now. Definitely don't want you bumping me when I'm, no, not right now. The first thing you want to do is get an alcohol swab and put alcohol on your vial while your ice pack is cooling down your leg. Okay? Then you want to make sure your needle's not going to come off, so I always twist the little protective plastic cap a little bit to make sure it's tight. Then pull that straight off. Now, whatever your dosage is, whatever they tell you you're going to need, you want to draw that much into, you want to draw that needle, that plunger down so you have that much air in your needle. So he's got me going 1, 2, 3, 4, 5 lines. So I'm going to come down 5 lines, and this is where I have to put my glasses on so I can see what I'm doing. All right? All right. So now I'm going to forget what I'm doing because I'm talking. So I'm going to have to be quiet. You put the needle into the vial. You push the air bubble up into the vial. And then you bring that thing back down. Now this could take a little bit of practice. And I have to keep my glasses on so I make sure I get the right amount of estrogen in here. Or estrodiol. It's called. It's synthetic estrogen. My dog is gone now, so I can close that door. And this stuff is very thick. This fluid is very thick, so it takes a while to get it in there. I'm not giving myself a lot. It just takes a long time for it to go into the needle and get into the syringe. All right? So I think I got it there. Then you want to hold on to it with one hand, keeping it into the vial, keeping the needle in the vial. You want to tap on it a little bit, and I see I got an air bubble on the side. So I'm just going to try to coax that air bubble up to the top. Now, got it. All right. That takes a little bit of practice, but you'll be able to get it. And he told me I want 1, 2, 3, 4, 5 lines. So I'm going to put that up there like that. All right. Now I have the right amount. I've pushed out all the air, and I have just the right amount of estradiol. And now I'm going to have to get another alcohol swab and swab my leg. Okay. So I'm going to take it out, and you want to be careful not to put your thumb on the plunger of the hypodermic needle. It looks like it's been 6 minutes, so I guess my leg should be cooled down enough. I'm going to pop off that ice, and I'm going to swab off the area where I'm going to put the needle. Real good. And then I want to make sure I got the slashed cut of the needle facing me, and I want to go in at a 45-degree angle. Now I'm going to pinch up my leg because I got real skinny legs. And I'm going in with the needle. And I'm probably hitting some scar tissue right now. But we're going to get it. I get a little muscle spasm sometimes when I go in. You want to be careful not to push too fast with the plunger once you're in there, because sometimes I did it real fast one time, and see, I'll digress, because it's got a retractable needle on it. When it comes out, when you push it all the way down, you push the plunger all the way down, it comes out, the needle goes up inside. So it's pretty safe. It could fail, but so far so good with me. They've all gone right back up inside the syringe. Anyway, I still, I put the cap on it, and of course you want to dispose of these needles properly, But I tried to push the plunger down too fast the first time I did it, and we increased my dosage, so we had doubled the dosage, so there was a considerable amount of estradiol in the syringe. And I tried to push it in too fast, and it literally, the estradiol came out around the plunger, the back side of the plunger. So I subsequently did not get the full dose that I was supposed to get. I didn't try to make up for it. I just waited for another week. I do these once a week. I waited another week and just did it right. I slowed it down, I go in slow with the needle for whatever reason. I don't know why. I'm still tentative about it. A lot of people can just jab it right in there and it's fine. As long as I hit a bone once on my backside, when I was doing it on my backside, I hit a bone, and it'll wake you up. So I just keep, I'm superstitious that I'm going to do that again. Now I have a little blood here on my, coming out of the hole. Sometimes I get blood, sometimes I get nothing. Sometimes it's fine, But I want to put something on that, something clean on that, to stop that bleeding. And usually, if I hold my thumb on it for 20 seconds, it stops. It's not a big deal. All right. So I swear to God, if you'd have told me 10 years ago I'd be on YouTube in shorts in a bathroom, I would have laughed in your face. Well, that's my estradiol injection tutorial. Love and peace to all.